Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you recognize, I just took my mask off, and not to get into the harangue of politics, the bottom line is, as a healthcare provider, as a instrumental, I hope, in creating a lot of healthcare professionals, and we are open here at Nova Southeastern University with all the PPE and the requirements of space distancing, and everyone has to wear a mask. So I'm asking you, please, take good care of yourself, wear a mask. This morning, really I should say this day, we're going to be talking about the lung cancer screenings and the yearly screenings that save lives. And we have with us today two representatives of Broward Health, Dr. Dennis Tishko, who is the Director of Thoracic Oncology at Broward Health. Welcome, Dr. Tishko. And also Aldo Calvo, DO, who is a Medical Director of Ambulatory Primary Care, Urgent Care, ACO, and Managed Care. Wow, that's a lot of work. But I remember Dr. Aldo Calvo because he was one of our products here from Nova Southeastern, and we're so proud of him. Welcome, doctors, welcome. Dr. Tishko, tell us about the lung screenings and the comment or the quote, yearly screenings save lives.
I'm glad to, and thank you for the opportunity, because in all of medicine, we hear so much about so many different things that we absolutely must pay attention to. It's hard to tell what really is going to give us the bang for the buck. Where should our efforts really be directed? And lung cancer screening is at the top of that list. Lung cancer is the #1 cancer killer in the country by far. And it's killing more people in America than colon cancer, breast cancer, prostate cancer, uterine cancer, ovarian cancer, and brain cancer combined. I mean, think about the magnitude of a problem that's worse than all of those other things. As you know, lung cancer has a notoriously bad history. Survival with it is pretty low. For instance, breast cancer has a 95% 5-year survival. Lung cancer, we're looking at about 15%, because up until recently, we had no way to find it. We had no good screening. But a new screening test, actually it's an old technology, CT scan, has been shown to really help people find cancers early and cure them.
Let me ask you, relative to that, the CT scan, I'm sure, if I'm not mistaken, that Broward Health recently acquired the highest level of CT scan, in other words, the number of slices, et cetera, et cetera. Could you explain that?
Well, CT scans are machines and software. So in order to do different scans for different reasons, you have to have the flexibility to change both the machine use and the software use. When we do a screening for lung cancer, what we're looking at is a high-speed, thin slice, high-resolution picture. The advantage to that is it really is high speed. For instance, the length of time, the scan time, is about 3 seconds. So it's really hard to imagine something faster than that. But we don't use any contrast, so there's no shots, there's no IVs, and that makes the test really not only literally painless, but also painless from the standpoint of time. The machine itself and the software is state-of-the-art, as you mentioned, and that gives us better images.
Now with the COVID-19 issue and the fear and the information, whether you want to call it misinformation, real information, combined information, the public is so concerned and really querying, what do we do? So the whole issue of screenings becomes, I would assume, even more important, even though we're getting out of the cancer field.
I agree with you, Dr. Lippman, that during this COVID pandemic, unlike we haven't seen since 1918 with the Spanish flu, individuals are scared to come access physicians like myself in primary care for screening of cancers and receiving immunizations and so forth. But I agree. I think it's paramount that our patients feel comfortable and to come to our practices or a televisit or telephonic visit in order to establish risk, deem who meets the criteria for having lung cancer screening, on all cancer screenings for that matter, and so that we can hopefully get them to perform these timely exams. Because as we know with pandemics, they don't really care who we are, whether we are a healthy person in our 40s or 50s, or someone who's older, who does have a long history of smoking, who possibly does not have a firm diagnosis of lung cancer because they haven't gone to it during the screening process. We have to encourage those patients to get risk stratification by getting these screening exams, identify these early stage cancers, and do the due diligence in not only treating them, but protecting them from other influences, such as these viruses like influenza and COVID that are circulating, especially now in the fall and winter. So it is of utmost importance that people like myself and our whole healthcare team at Broward Health and throughout our community make sure that our patients feel comfortable in coming to places of our brick and mortar clinics or doing a virtual visit in order to get these timely exams.
Well, I really didn't want to misdirect the thematic presentation on the show of screenings for lung cancer, but I have to tell you that, the people that view us and ask questions, that's why we come to you and ask you, can you be on the show to talk to us about, in this case, lung cancer? But it's obvious that when I open up the show and I ask people to wear a mask, that I'm hearing from them, what do I do? And having experts such as yourselves here focusing in on screenings, it seems to me that it was an obvious responsibility on my part to ask the previous question. So let's get back to the lung cancer screening issue. So Dr. Tishko, talk again, because I think your statements about the numbers of people that are affected and who are no longer with us, in other words, pass on because of the non-knowledge of having lung cancer, and are still living through a period of time where we have the effect of multiple use of certain products, whether they be tobacco or otherwise, or the air quality. Talk to us again, or get back to the lung cancer screening issue, please.
Sure, I'm glad to. And I'd actually like to just kind of go back to what you were saying about the vaccinations and COVID and how people think about that. I think what we're really talking about is just being smart about yourself. We all know that we need mammograms. Every woman is very well aware of the fact that she needs a mammogram. Those of us over age 50, we've all had our colonoscopies, and there's certainly very low entertainment value for the colonoscopies, but we know it's something that we need to do. It's part of our maintenance. And for those people for whom a significant smoking history is part of their background, the screening is part of the maintenance. Getting vaccinations is going to be part of the maintenance. And I think if we can make it very matter of fact and make it just a part of being alive and being responsible, it's just one more thing that we have to do. It's like changing the oil and rotating your tires if we want to be safe and smart.
Hopefully with the new methodologies, the new technology, the new advocacy for lung cancer screenings, that they become as important, as you say, as mammograms, as pap smears.
Well, and I think you raise an excellent point. And what we're really talking about here is demystifying things. We all know women need mammograms. We all know about our colonoscopies. We all know about PSAs. It's just part of our conversation. We talk about it as if it's a normal element of everyday life, and that's what we need to be doing with the lung cancer screenings. In terms of the effect, in terms of what does this mean for lives saved, lung cancer screening is going to save more lives than colonoscopy and mammography put together, probably significantly more lives. So for those listening, if you think mammography is important and you've gotten your colonoscopy, add that up, and that's where we start with lung cancer screening. For instance, if you look at a big study, a very large study recently completed, 5-year survivals for patients who were screened is 71%, patients who are unscreened, 19%. There is no question, absolutely no question, that patients who should be screened need to be screened. And even if you yourself or those people listening didn't smoke, if they're not in the population, they know somebody who did. Somebody close to them has either died of lung cancer or is at risk and should be screened. So I think it's a conversation that all of us can have, whether we're the patient for whom screening is appropriate or not. Somebody out there could benefit from the information. And that's why I think this kind of a program is so vitally important. I think that's why Dr. Calvo and the primary care docs are so vitally important, because they can have that conversation. So I think you raised an outstanding point.
And if I can add to that too, what Dr. Tishko is saying from a primary care perspective, if you look at lung cancer, as Dr. Tishko said, it's the leading cause of cancer death in the United States. And if you add up all the deaths attributed to breast cancer, prostate cancer, and colorectal cancer, it still doesn't add up to all the lung cancer deaths that we see in this country every year. And it probably hasn't had as much focus as breast cancer, colorectal cancer, or prostate cancer over the years, but we're really trying to pivot and put an emphasis on the community of the importance of getting screenings. And even in our electric health record, and not just ours at Broward Health, but others throughout the country, now there is an automated way to identify those at-risk groups who have smoked for a period of time, a certain age group, to alert us as primary care physicians to get low-dose CT scan screenings done. And annually, as Dr. Tishko is passionate about this, it's just not doing it once. If you're in a specific risk group, you got to do it every year, just like you would do any other screening exam. This is the literature. This is what the evidence says. Because although you may not pick it up on year one, that's not to say in year 3 or year 5, we won't be able to pick it. And the good thing about it is that if we do pick it, we can hopefully diagnose it at its earliest stage. And as Dr. Tishko stated, you have a better survival than if you did it when it's already at a later stage and it's become metastatic, which lung cancers are pretty aggressive tumors in that.
Dr. Calvo, let me, since you have these urgent care units and the ambulatory primary care units, where are they located? I guess throughout Broward and beyond that, correct?
Yeah, correct. We are located, most of our offices in upper 2/3 of the county, from Griffin Road all the way up to the border in Hillsborough. Our urgent care centers are conveniently located, one in Weston, one located in Coral Springs Plantation, and in downtown Fort Lauderdale. Our ambulatory primary care centers are scattered throughout, as far north as Margate, in Coral Springs, Deerfield and Pompano, Fort Lauderdale, and in Plantation as well. So we're pretty much easily located by most people here in Broward County, and we have individuals come from Dade and Palm Beach who work in Broward County. And we are one of the leading healthcare systems here in delegating primary care services in Broward County, just due to our size, our primary care workforce, our location, and then of course our collaborations with institutions such as Nova Southeastern University and on our education, and Broward Health Medical Center being a statutory teaching hospital as well for many residency programs, as you're aware, Dr. Lippman.
Oh yeah, we've been with Broward Health since the early 1990s, as you well know. Let me just quickly, the urgent care centers, are they 24/7?
Urgent care centers are 7 days a week, but not 24/7. They're usually open up for 12-hour shifts, and they're there for minor illness and minor injury. But the convenient thing about these urgent care centers is that they work with our ambulatory team. So although patients may come in with their primary care physicians, we sometimes identify patients who are not plugged into a regular source of longitudinal care. So patients always have choice, of course, of choosing where they seek their primary care, but we are conveniently located, and sometimes we help assist in navigating patients into care, because sometimes we have those 50-year-old individuals who probably relocated here and do not have a regular source of healthcare, but need these preventative services, these screening services, because they have risk. So it's our responsibility, even in the urgent care centers, to be an integrated healthcare system to try to help patients throughout their longitudinal care, getting into not only longitudinal care, but getting, again, all these services. That's very key and pivotal because, as we all know, we're a dynamic population, and we could be living in South Florida, and then the next day we're out of the county, or someone relocates into our facilities here. So we need to be good shepherds of healthcare and help our patients get to the right place.
Well, it's very interesting, Dr. Tishko and Dr. Calvo, because I say this. I've been putting it as part of my rhetoric on the programs lately. For many, many years, and I'll go back to the years when I used to sit with Dr. Morton Terry, the founder of the Health Professions Division, the founder of Southeastern College of Osteopathic Medicine, the first school that we had. He always used to say, isn't it a shame that we have to go to New York or Texas or I'm not going to name the institutions, or to Chicago or wherever to get the best of care. But it's not like that. It's changed dramatically in South Florida, in Dade, Broward, and Palm Beach County. And it must be, I guess you could say, a good feel for you, because you have the opportunity to work with individuals who are not only as capably trained as both of you are, but also are collaborative. Is that not true, Dr. Tishko?
Oh, it's absolutely true. And I think many people would probably be surprised at how much of medicine happens in a conversation. Dr. Calvo will call me, or I'll call him, and we'll talk about a patient. What do you think about this? What do you think about that? What's the history? An awful lot of medical care happens as a conversation, maybe not in the chart, maybe not with labs or x-rays, but talking about an individual and where they are in their healthcare journey. And I think having that access is really important. I think it also surprises people, particularly with cancer, that the overwhelming majority of cancer care done in this country is done at the community level. It's not done at giant research institutions. The majority of cancer care, 85 or 90% of cancer care, happens locally. So there's very little reason why someone would need to leave the area. It just doesn't happen that often.
Well, the reason I remind or try to make it an issue to present to our viewers is because, again, we are an unusual compilation of population. We have the largest number of children in the K through 12 systems, if you take the 3 counties, of any combined area in the United States, almost close to New York, all right? Close to New York, New York City. But we also have a situation where we have the highest number of people, percentage-wise, over the age of 70 of any place in the United States, in Dade, Broward, and Palm Beach County. So you have people who have pre-existing conditions, which they're not aware of, and this talk about lung cancer screenings now adds to a checkbox, I hope, that they bring into their categorical wishes of wanting to have an extended and fruitful and happy life. Am I preaching the gospel here, Dr. Tishko?
No, but I think you're laying it out in a very logical, very simple format. Yes, that's exactly it. It's just part of what we need to be doing, and our population, particularly the older folks, needs to be paying attention to this. It's just part of living. Very often people will come into my office and I'll actually hear this. People will say, if I have cancer, I don't want to know about it. And I think that's a real opportunity to have a very clear discussion about what's a good idea and what's a bad idea. So having those discussions can sometimes open up the fears people have. I don't want to get screened because if it happens, then somehow magically it'll be worse. And we need to be educators and telling people, no, the sooner you catch it, the sooner you can be cured. I think It surprises people that lung cancer is caught early. A stage 1A lung cancer can have a 90 or 95 or 100% survival. So early stage lung cancers can be cured, not improved, but cured. And that's the message that we need to get out.
Dr. Calvo, with you seeing the multiplicity of patients at a primary care level, it must be a daunting task, but yet a pleasant task to be able to work with people like Dr. Tishko and all the other great health professionals that we have in Broward, Dade, and Palm Beach County, and particularly at Broward Health, to know that they're there for you to communicate with, because you're the watch person, and they're waiting to hear from you. Is that it?
Dr. Lippman, it's exactly right. There's a huge responsibility in being a primary care physician, because I have to, as my other colleagues in our division, have to have the same knowledge as Dr. Tishko does, or any other surgeon or oncologist, to be able to give the information correctly to our patients. So for someone like myself, who day in and day out will manage minor illness and minor injury, manage chronic care conditions such as COPD and hypertension, diabetes, and then do these wellness exams such as cancer screenings, immunizations, making sure that patients get screened for diabetes and other conditions. That's my wheelhouse. It's my responsibility. And then convincing patients and having those in-depth conversations about why it's important to do these wellness and screening exams. And you hit it really well, and you articulated that Florida, more people are moving into Florida, the whole state, than any other state in the country. And this for not only just for our beautiful weather, minus the hurricanes, of course, but they're here because this is paradise, and they need to be able to get care, and they have to get the right care. So what I've noticed over the past couple of decades is, yes, we are certainly building up at Broward Health an integrated healthcare system, making sure that people like Dr. Tishko, well-trained individuals, come here to help our community. But as Dr. Tishko also said, that we have this line of communication, because the focus is always on the patient. It's always the patient journey. So it's not just myself or Dr. Tishko, it's our care coordinators, our nurses, our pharmacists, our medical assistants. Everyone has an important role in that patient's care, because I may be the one who orders, in the case of lung cancer screening, the low-dose CT scan, but someone is helping the patient get the referral, the authorization to get that test done, and then the information back to me so I can make those decisions. And that's why it's important. I want to also mention one last thing, that we're very fortunate that Medicare, for our seniors, the most vulnerable patients, the Medicare annual wellness visit actually supports lung cancer screening for those who are eligible. And it is free at no copayment or deductible. So that's why it's important for even our seniors, again, our most vulnerable for all cancers, to come to people like myself to get these timely health promotion, disease prevention exams done, so that I can not only order a low-dose CT scan on the patient if they meet the risk for lung cancer screening, but also colorectal cancer, breast cancer, any other cancer, and other screenings like immunizations as well. It's free, it's no copayment, and we just have to get our patients to come see us.
I'm glad you brought that to our attention, because I was just about to ask you that question, because we have a lot of folks who watch us. I can tell you it's a wide spectrum, but an overwhelming number of people is what I call mature, and moms at home that are not necessarily, or dads at home that are now watching their kids, and they get to see the show. It's an imperative for people to know that we don't want to put up a barrier to the access of care that would enable you to carry on your life in a healthy way. So we're down to the last minute and a half almost of this show. So Dr. Tishko, I'm going to ask you to give me a final statement.
Well, I'd like to echo what Dr. Calvo said. For our Medicare patients, it's free. It's fast, 3 seconds, and it's extraordinarily effective. For those patients who are underinsured or uninsured, Broward Health also offers the scan for $99. So in terms of an investment, I can't think of a single thing out there that isn't worth $99 for a life. It's fast, it's free, it keeps you alive, and it's something that everybody needs to be thinking about. if not for yourself, for somebody you clearly care about.
Well, thank you, Dr. Tishko. We really appreciate you being here today. As a director of the Thoracic Oncology units at Broward Health, we thank you. We thank you for your knowledge and your commitment and your advocacy. Thank you very much. And Dr. Calvo, it's good to see you again as a product of Nova Southeastern University College of Osteopathic Medicine and a great primary care physician. I know you are because I check up on you as I do all of my children per se. And thank you very much for being here today. So folks, I can only ask you to do one thing. I ask you to take good care of yourself. The way you take good care of yourself is be cognizant of the fact there are opportunities to take good care of yourself. Dr. Tishko, Dr. Calvo made you aware of the fact that there should be no barriers for you to have lung cancer screenings, which will save your life. So remember, two things. I'm going to end the show by telling you one more time. You see this? This is called a mask. It's not a political issue. It's a real issue. Protect your lungs. Protect yourself. Fight off this insidious, ugly coronavirus. Please, fight it off. And it's inside of you to do that. Thank you very much for showing up again this week. We appreciate you allowing us to come into your homes. Remember, this program has an opportunity for you to contact us with a telephone number or an email. We'll try to get you your answers. And also, remember, we come to you from Nova Southeastern University. And my name is Fred Lippman. Until next time, see ya.